This is Travis from KDT Decompression Systems Technique, and today we're going to show you, introduce a new product to you called Bilateral Knee and Hip Distraction. So this idea came about as some of our clinics do actually use the knee and hip unilateral kit, and they're finding that a lot of patients either need or want to have both extremities distracted, so both knees or both hip joints. And you figure most people have two degenerative hips or two rheumatoid arthritis knees, something like that. So the idea was, instead of treating the patient for 10 minutes on one knee, let's say, and then switching it over to the other one, increasing your treatment time to 20 minutes, you can do both now at the same time. And we've also made the ankle cuffs a lot more comfortable. So we're going to show you how this works. So Sam's going to go ahead and sit back here and spin and lay back on the cushion like we do in the supine position. And what we're going to do now is we're going to have her bend her knees up a little bit here. We're going to lift the bolsterless leg up some. And we're going to put the ankle bolster in the back of the ankles. Then we're going to grab our bilateral kit. So it's two ankle cuffs. I'm going to set one up here for right now. We're going to open it up. If you'll see here, it has two loops that slide on the actual strap. We're going to lift up her ankle, slide this underneath, and we're going to slide this side down so it's on the medial side and one on the lateral side of the ankle. We're going to roll the padding in underneath, pull this across, and Velcro them both together. Just go ahead and pull, make sure it's comfortable. You're going to put the second one on here. Your ankle, put it down. Put this underneath, same way. Slide this part down. Have your staff belted up just like that. Make sure it's comfortable. Then you're going to grab your spreader bar, which will connect both of those together. Put it through the loops here. You're going to attach your rope to the system there. We're going to raise her almost the whole way up until the rope clears. About right there. And then we're going to apply the slip-stop blocks to stop her upper torso from sliding. So we're going to slide this underneath the rib cage on this side and underneath the rib cage on this side. You can also use the axial post too if you would like. So you're going to go ahead and unlock the table if you're trying to get to the hip joints. If you're trying to do the knees, it's totally not necessary to unlock the table section. You can come over here and pull out your protocol. So you're going to go lumbar 4 and hit start. And then for the bilateral, you're going to keep it simple. So you're just going to take the unilateral number that you start with that the patient can feel. So let's say it's 20 pounds in the knee, and you're going to double it. So if you're trying to do bilateral both knees, you're just going to go to 40 if 20 was enough on the one side. And in the instructions, we have the body weight calculus to help you and to guide you in the correct amount of pull force. So we're going to hit set here, and I'm going to turn it up to 40. Leave the rest at 10 pounds, and go ahead and hit start. Have the computer head pull. It's just going to tighten everything up, and it's going to start distracting both ankles. Then it will go to both knees. And then if you're trying to get to the hip joint, you're just going to increase the poundage. Say 10 or 20 pounds will give you enough then to get to the hips. If the patient isn't feeling it, you can drop everything down. So you can take out the ankle bolster and drop this a little bit more flat. Then you can get a little bit more pressure in the hip joints there. The front of the table is elevated up some. That's also another thing. It's a little more comfortable like that, but if you drop this section down, they're going to feel it a little bit more in their hips. Okay? And you can adjust the force as it's running. So if you communicate with the patient and she's not feeling it in her hips yet, we're going to go ahead and hit the set button. Say we'll turn it up to 50 pounds. Hit set twice. It automatically will change the pull to more force there. So that's it. Have a great day. you.